Hi, I am Dr. Laura Stoppelbein. I am a clinical psychologist and also the director of the University of Alabama's Autism Clinic. And I'm here today on behalf of the Regional Autism Network and talking on the topic of parent self-care and parent resilience. A topic that I think a lot of times gets lost when we're under stress because we are so focused on taking care of our children, taking care of others, and making sure just the day-to-day management of our life is going on appropriately. So we oftentimes forget that part of our management of stress is also doing the things to take care of ourselves. So I'm going to talk a little bit about that topic today for us. Obviously, having situations like the COVID-19 virus adds additional stress to everyone's life. But regardless of that, prior to having the COVID-19, um, everyone experiences stress. It's a universal experience, whether it's the area of finances, or maybe it's the area of physical or mental health. Maybe it's concerns about living situations or just overall life stressors. Can be things at work, can be our relationships, but we know that there's a lot of different things that cause us stress in our day-to-day lives. Most of the time when we think of stressors, we think about the negative impact that that has and the things that put us at risk for experiencing more negative outcomes with the experience of stressors. But what I wanted to kind of focus on today was the idea of protective factors. And we know that parental resilience and parental self-care is a protective factor against the negative impact of stress and stressful life experiences for parents, but as well as the overall family themselves. So parental resilience itself is just defined as the ability to constructively cope with, bounce back from challenges or what we would call stressors, but maybe naming them as challenges and being able to kind of effectively adapt and bounce back from those when they occur. So again, we know there's common themes of stress and challenges that occur in everybody's life, those day-to-day things, unexpected events, death of a loved one, a sudden loss of a job, just a sudden expense that came up that maybe you weren't expecting. But we know that parents who have higher levels of resilience and parents who engage in more self-care activities tend to have better outcomes for themselves and their families when these things arise. And resilience and self-care is a skill that you have to practice, build, and be intentional about, just like any other skill that we learn and develop in our lives. One interesting and very relevant fact that we know in the field is that when you interview or survey parents, most parents indicate that working with their children, caring for their children, is in general more tiring than their everyday paying jobs that they go to. But by the same token, they also say, parents say, that taking care of their child, caring for their children, making sure their emotional and physical needs are met, all those activities are far more rewarding than their everyday jobs that they hold, which means that's great, but it also means that we're far more likely to try to work so hard that we tire ourselves out, unlike maybe what we would do at our regular day-to-day jobs where we would realize we've got to stop, we've got to put some things down, we have to take care of some other priorities in our life. And so that oftentimes kind of gets parents caught up in the cycle of feeling guilty if they actually stop and put the brakes on being a parent for a minute and do some things that will help rejuvenate themselves. So just broadly, what are the ways that we try to build resilience as parents? And we're going to focus today on the first one, which is self-care. But there are other ways as well. So planning and adapting to change, making sure you build in some margin in your life so that as much as you can, so that when emergencies occur, whether it's financial, whether it's emotional, whether it's just a really bad day that we sometimes have, that we have built in enough resources for ourselves. Again, whether that's an emotional resource, a spiritual resource, a social resource, that we can plan what we would like to do and then know that we maybe have to adapt and tap into some of those other resources in our lives. And then building social supports and concrete supports. thinking ahead to what may be the challenges that I'm going to face over the next little bit. Who in my life can help me face that challenge? Who in my life is supportive and can be rejuvenating? And just because we're socially distancing doesn't mean you have to be socially isolating. So reaching out, building those connections, and then finding ways to get those concrete supports when you do need those. All of these are ways that we know that parents can build resilience for themselves and for their family. Focusing though predominantly on parent self-care is what we're doing today. And parent self-care is just as important as taking care of the physical and emotional needs of your children. Taking care of yourself impacts your physical health. It impacts your mental health as a parent. It impacts how you manage your child's behaviors and how you manage your parenting with your children. And then it impacts how and what resources we have to be able to build relationships with other people so that we have those relationships there as we need them and to provide support for other people when they need it. So taken together, self-care really impacts all the major and important areas of our life. There's a lot of myths out there about what self-care is, and cognitive or belief distortions around what self-care means or what it represents. One of them is self-care is an indulgence. Self-care is not an indulgence. Self-care is a necessary component of being a healthy person and being able to maintain your health and your sanity. Self-care is selfish, taking time for yourself, building in some boundaries into your life. That doesn't mean selfish. That actually means that you're teaching others how to treat you and expecting them to respect you as an individual. Self-care is a one-time experience. No, self-care is a mindset. So again, as we said, it's a skill. It's being intentional. It's planning. And it may take some planning, a little bit of planning at the beginning, but then it becomes part of your day-to-day life. And we'll talk about that in just a minute. Self-care is time-consuming. It does not have to be time-consuming. It can be 10 minutes in the morning. It can be a 15-minute activity in the evenings. It does not have to be a big, long, time-consuming process. And similarly, self-care requires a lot of time each day. We're not talking about a lot of time each day. We're talking 15, 20, maybe 30 minutes during your day to do something that takes care of yourself and helps refill your resources so that you can then provide for your family members as well. In trying to put together what you would do for self-care, a lot of times we get caught up in kind of this big picture of self-care rather than and missing then the daily activities that we could do that would be self-care and rejuvenating for the self. Self-care does not have to be planning a big vacation, getting away from your children for a weekend, taking time off of work for a week. That doesn't have to be self-care. That can be part of it, but that doesn't have to be what self-care is on the regular basis. Pulling away, sitting down, doing things that you enjoy for 10 or 15 minutes in a day is rejuvenating. It does not have to be the big picture thought of what most of the time we think of when we think of, oh, I've got to take care of myself. I need to take a spa day. It doesn't need to be the whole day. It can just be little things throughout the day or throughout the week. So then how do we do self-care? I think it's important to think about some specific techniques that will help you identify what are the things that are self-care for me. There are some people that social connection, spending a lot of time with other people, that's rejuvenating for them. They get energy from that. They enjoy that. There's other people that need time away. They need to sit down and read a book or flip through a magazine, or they just need to sit outside on the porch by themselves for a few minutes and scroll through Facebook. All of those things are self-care. It's a matter of identifying what are the things that rejuvenate me and make me feel better, as opposed to what do we think, should self-care be. So kind of going through some of the techniques, knowing your own oxygen mask. So again, knowing what makes you feel better. If you want to just sit on the back porch, take your dog out there with you, pet it, talk to it, just spend time with someone who's not going to talk back to you for a minute, that can be self-care. Or it could be, if you enjoy cooking, it could be doing things like cooking, trying a new recipe, spending some time in a garden, tidying up, not cleaning your whole house necessarily, unless you really love doing that, but just tidying up an area or cleaning out a drawer. That can take you 20 minutes. That can be self-care if that's something that you enjoy doing. I think it's important to remember as we are trying to identify what is self-care and what can I do for self-care, to remind ourselves that it's okay to do things like double task at times. Sometimes we have to do more than one thing at once. Our life requires that. But multitasking is really a major cognitive, emotional drain. So trying to talk on the phone, take your kids for a walk, and manage the dog all at the same time. That's a lot of things at once that it's going to be hard to do. So a task that should be rejuvenating then becomes something that's more of a stressor than we anticipated. So double task, okay. Multitask tends to cause a lot more stress and strain on us. Another way to increase self-care is paying attention to the things that you want to see increase. So I'm sure there are some things that have changed in your life, hopefully, through this social distancing in the past 6 to 9 weeks that we've had at this point when I'm filming this, of quarantining or social distancing. Maybe it's that you've been able to spend more time with your family that you didn't get to do before, or maybe it's that you've been able to take a walk every evening, or more frequently during the week, and that's something that you enjoy. So thinking about how would you like to have that happen as we move back into our day-to-day lives. All that is an important way to increase your self-care, because it gives you something that you enjoy and something that you like that's rejuvenating for you, and helps you hopefully find a way to do that. Talking to yourself like you would talk to a friend. Not having so many shoulds. We talk to ourselves in a lot of shoulds. I should be this way as a parent. My child should act a certain way. I should do this to be a good coworker, to be a good spouse. Giving yourself a little bit of grace, and it would be nice if, rather than saying it should be, or it would be great if this happened, but understanding that it may not, and it's okay if it doesn't. You're not bad at that thing if you don't accomplish that particular goal or have that particular event occur. And then finally, asking for help. Being a parent is a hard task. Nobody gets it right all the time. Nobody does it perfectly, but most of us try pretty hard to be a good parent. But knowing when you've kind of reached a limit in your abilities and asking for help, whether that's getting concrete help that you need or getting the social support and help that you need, all of that is important. I've enjoyed being able to put this together and talk with you virtually, and hope